So at the Presidential Symposium, I'll be discussing the data on the LUX-Lung 7 clinical trial. At the current time, there are essentially 4 EGFR inhibitors that have approved in various parts of the world as initial treatment for patients with EGFR-mutant lung cancer. And this is really the first clinical trial that asks the question, is there any difference amongst those if you use them as initial therapy? And it's a randomized trial comparing gefitinib to afatinib in patients as initial therapy for EGFR-mutant lung cancer. And so we'll see at the symposium what the findings are and whether or not this ends up changing or how we approach patients with newly diagnosed EGFR-mutant lung cancer. What the findings demonstrate in that is that there is a difference in progression-free survival in patients who receive afatinib compared to gefitinib. And I think as a community, we need to decide what the significance of these findings are. There are also more toxicities with afatinib compared to gefitinib, and again, it's a balance for individual patients whether they choose, whether they or their physicians choose gefitinib as the initial treatment or afatinib as their initial treatment. But I do think it's an exciting study and adds to our knowledge of how to best take care of patients with EGFR-mutant lung cancer.